Hey guys, this is Ben with Renal Anatomy. This section can seem like a subject that requires a lot of memorization, but by the end of this lecture, we will see that the renal system is very practically organized. It is this overall organization that allows for the kidneys to perform their ultimate function, which is to do what again? To conserve water while eliminating waste. In order to appreciate the ultimate function, we first need to study the kidneys at both a microscopic and a macroscopic level. At the gross anatomical level, the kidneys are retroperitoneal organs, and they're located at the level of about which vertebrae? It's T12 through L3 on the left and slightly lower on the right due to the presence of the liver. The kidneys are part of the SAD-Pucker mnemonic and specifically the K, so let's run through that briefly here. S in SAD-Pucker stands for suprarenal or adrenal glands. A stands for aorta or IVC. D stands for duodenum and specifically the second through the fourth parts. P for pancreas, not including the tail. U for ureters. C for colon, specifically only the ascending plus the descending colon. K for kidneys. E for esophagus, only the lower 2/3. And don't forget about R for rectum. You can see all these structures down in this picture here on the bottom of the screen, so feel free to pause it and take a look at those before moving on. Remember, repetition is key to learning, so feel free to go over this a few times. Moving back, let's talk about the kidneys' overall blood supply. The kidneys receive blood from the renal arteries, which branch from the abdominal aorta at the L1 level, and from the renal veins, which drain venous blood into the IVC. Keep in mind that the renal veins pass in front of the renal arteries and aorta. There are also two important points about the renal veins that I want to point out. The first is that the left renal vein is longer than the right, which is why it's chosen for living donor transplantation. So why do you think the left renal vein is longer? Well, it's pretty simple if you think about it. It's just because it has to travel a little bit longer of a way to get over to the IVC, going over the aorta that you see here. The second thing that I want to point out is that the left gonadal vein drains in the left renal vein and then the IVC, so it has a little bit of an extra step. You can see here the left gonadal vein draining first in the left renal vein before entering to the IVC. This is in contrast to the right side where the right gonadal vein drains directly into the IVC. The importance of this is that the left gonadal vein has a few more twists and turns before it can actually get to the main drainage pathway. What this means is that variceles are more common on the left side of the body. And quickly, do you remember what a varicele is? Well, a varicele is actually an engorgement or an enlargement of the piniform plexus in the spermatic cord. This picture shows it nicely here that you can see by the dilated veins. It is classically described as a bag of worms on physical exam. It can be a painful condition that causes reduced fertility. Sperm production occurs at a slightly lower temperature than body temperature, which is why the scrotal sac is located outside the abdomen. The testicles are kept in a cooler environment, which is also controlled by the amount of blood flowing to the scrotum at any given point in time. This next picture is a gross image of the left kidney. As you can see, the left gonadal vein is draining directly into the left renal vein. Now, why is the left renal artery not labeled in this image? That's because we can't see it. Remember, the renal vein passes in front of the renal arteries and aorta. Now, if you follow the ureter's course, you can see that it originates from the kidney hilum and descends inferiorly to the bottom of the image. Unfortunately, the scope of the image ends just prior to the interaction between the ureter and the gonadal vessels. However, do you know the anatomical relationship between these two structures? That's correct. The ureters course underneath the gonadal vessels. Another part of renal anatomy involves its sensory innervation. The kidney sends sensory innervation to the spinal cord at the T10 and T11 levels. This pain from the kidney is commonly sensed in the T10 and T11 dermatome, and on physical exam, one can elicit pain in this region. It's called the costovertebral angle, which I've highlighted here with my red pen. On the test, costovertebral angle tenderness is often a huge clue that will point you towards the kidney as the culprit for the patient's symptoms. For example, in pyelonephritis, there's a common presentation with this type of pain distribution. So be sure to give some time to the physical exam findings in the question stem. It can save you a lot of time on the test and lead you toward the correct answer. Time for a flash quiz. Why is the left kidney, rather than the right one, harvested for transplantation? That's because the left kidney has a longer renal vein. Remember that the IVC lies to the right of the aorta, so the left renal vein will be longer. This picture just showing you here where that eventual transplanted kidney will end up. It's frequently dropped down into the pelvis, and that's why you need some extra wiggle room with that vein to make it all the way to where you need to go. Time for a test yourself. A 22-year-old man arrives in the emergency department with multiple stab wounds. Bedside exploration reveals that the wounds extend through the peritoneum. The patient is taken to the operating room where the surgical exploration reveals splenic and hepatic lacerations. No renal lacerations are found. Which of the following describes the anatomic location of the kidneys? A. Approximately at the vertebral level T10 through L1. The right kidney is higher and more medial than the left. B. Approximately at the vertebral level T10 through L1. The left kidney is higher and more medial than the right. C. Approximately at the vertebral level T12 through L3. The left kidney is higher and more medial than the right. Or D. Approximately at the vertebral level T12 through L3. The right kidney is higher and more medial than the left. Answer: C. The kidneys are located between the parietal peritoneum and the posterior abdominal wall. They are retroperitoneal organs only partially covered by the parietal peritoneum anteriorly. The kidneys are located approximately at the vertebral level of T12 through L3 and covered by ribs 11 and 12. Because of the liver, the right kidney is slightly lower than the left and more lateral, whereas the left kidney is slightly larger than the right. On cross-section, the kidney can be split up into a cortex, a medulla, and a collecting system. So let's briefly run through that here with some drawings. The cortex is actually just the outer little portion here. The medulla is right inside it, and the collecting system is the most inner part here. The medulla consists of the renal pyramids and columns, while the renal cortex consists of the parenchyma that's above the medulla. You can think of this like an orange, where the fruit inside is the medulla and the orange peel is the cortex. The collecting system begins as the minor calyces that you see here. They eventually form into major calyces, and they drain into the renal pelvis, which is here. The renal pelvis then will go on to drain in the ureter, which goes to the bladder. Finally, the bladder drains to the urethra, which has two sphincters, an internal and an external sphincter. Do you remember which of these two sphincters is under involuntary control? Correct. The internal sphincter is controlled by the autonomic nervous system and is under involuntary control. The external sphincter, on the other hand, is controlled by the somatic nervous system and is under voluntary control. The vascular system of the kidney begins as the renal artery. That will eventually branch into a segmental artery and then into an interlobar artery, which tracks over the renal pyramids. As the interlobar arteries arch over the renal pyramids, they become the cruate arteries. These then become the interlobular arteries, which are these little straight pointing arteries at the top that you see here. The next vessels that come up after the interlobular arteries are clustered around the nephron, and so we need a more microscopic picture to see them. Here are the interlobular arteries that we just briefly described. They eventually give rise to the afferent arteriole here, to the glomerulus next, to the efferent arteriole. The efferent arteriole will eventually then give rise to something called the vasa recta, which is this diffuse capillary bed surrounding all the tubules within the nephron. From there, the efferent arteriole will drain into the venous outflow of the kidney that you can see here. The venous outflow eventually converges onto the renal vein. A quick way that I remember this mnemonic is rough sport is always interesting at age 10. Playing with the letters a little bit, I just imagine two 10-year-old kids roughhousing, or doing something relatively aggressive like most 10-year-old kids do, and I can remember this mnemonic. all you gotta do is treat the two V's as the Roman numeral 5s. Then those two 5s become 10. Keep in mind that this is not incredibly high yield, but just another mnemonic you can write down at the beginning of your test in the event you do get asked a question about renal blood flow. This next picture shows the glomerulus, which is a compact spherical capillary bed where blood is filtered. I'm highlighting it here with a red pen. A specific arteriole called the afferent arteriole actually brings blood into this tuft of capillaries called the glomerulus. The efferent arteriole brings blood away. This can be tricky to remember, so you have to remember one simple thing. The afferent can be thought of as the arriving arteriole, and the efferent can be thought of as exiting. As blood enters into the glomerulus, it is filtered in a process where plasma, electrolytes, and amino acids are filtered into the beginning of the nephron, which is called Bowman's space that you see here. From Bowman's space, this newly filtrate actually passes into the proximal convoluted tubule, and from there into the loop of Henle. Let's draw this out quickly. The filtrate passes into Bowman's space, into the proximal convoluted tubule, down through the loop of Henle, back up into the distal convoluted tubule, and eventually all the way over to the collecting tubules. The collecting tubules will drain into the minor calyx at the tip of the renal pyramid, which is called the what? The renal papilla. On an exam, you may be asked about a coordinated system used by the body to counter hypotension because of hemorrhage or even severe dehydration. Do you have any idea how the kidneys play a role in this? Special blood pressure sensing JGA cells, or juxtaglomerular cells, which are located in the tunica media of the afferent arteriole, secrete renin. These cells that I'm showing you here. Renin is an enzyme that catalyzes the first step in the homeostatic blood pressure elevating renin-angiotensin-aldosterone system, or RAS for short. Let's go over this quickly. The sequence begins with renin converting angiotensin to angiotensin 1. And remember, this is all accomplished by renin. Eventually, angiotensin 1 will be converted by another enzyme in the lungs to angiotensin 2. Any idea what enzyme catalyzes this second reaction? Correct, that's the ACE enzyme, or the angiotensin converting enzyme. Angiotensin 2 then does a few things that will overall raise blood pressure. First, it will vasoconstrict. Second, it will cause salt reabsorption, and then water reabsorption. And quickly, in addition to decreased blood pressure, what are some other factors that stimulate renin secretion? Well, that'll be decreased sodium levels, actually sensed by the macula densa, and also an increase in sympathetic tone. They will all have a positive effect on renin, which will then initiate this whole cascade. One last point is that the efferent arteriole doesn't just go off somewhere, it actually forms the vasa recta, which is that diffuse capillary network that's surrounding the nephron, eventually helping it to store and gather nutrients that were once secreted into the tubules. What will be the function of these capillaries? That's right, resorb the filtrate, unlike the glomerular capillaries, which do what? Filter the plasma. Now it's time for a flash quiz. What is the first component of the nephron that filtrate will see after leaving Bowman's space? That will be the proximal convoluted tubule.